We're starting to hear more about the uptick in the number of COVID cases, and now the booster vaccines being made available across the country. We thought it was the perfect time to talk with pediatrician Dr. Cyrus about COVID and our children. Good morning, Dr. Cyrus. Thanks for being with us.
Good morning. Thanks for having me.
Talk to us a little bit about the numbers and what you've been seeing specifically in your practice.
Well, in our practice, the numbers are definitely going up. We know that there's over 15 million children and adolescents have, tested positive for COVID. And so they're having very similar symptoms, but a lot of them can be asymptomatic. So that number could even be a higher number than even adults. And so when you think about the incubation period of time, it's around 14 days is what we're trying to figuring out. But we kind of also know that it can change with each variant.
Now, I know that some kids may have underlying health issues or medical conditions. How does that play into if they were to get COVID?
Well, when we see children with cardiac problems or lung problems, obesity, things on neurological issues, if COVID gets these kids, they can complicate those conditions that they already have. And so it's really important that we do everything we can to protect those children.
What have we learned about the benefit of a vaccine?
The big aspect of the vaccine is that it's really reducing the hospitalizations. We see that, people who have gotten the vaccine in the adult population and in the pediatric population, they may still get the virus, just like we get the flu shot. We may still get the flu, but typically it's much more less of an effect, and it keeps the hospitalizations down.
Let's talk a little bit about the specific symptoms because it's really hard to determine what those symptoms mean.
Well, it's true. Even in my office, I may have a child who comes in with a runny nose and a cough. 8-month-old was just about 3 weeks ago. And so we find that, we think, oh, well, they have a little cold and a cough, but we check them and no, that's not a typical common cold, but it's coronavirus. And so we find that they can be mild symptoms. They could be wheezing, much like RSV. This is a virus. This is going to act like a virus. It's going to act like maybe flu. It could act like RSV. Could mimic some other viruses, and we really don't know until we actually get that test and get it confirmed back. But we're going to treat them symptomatically, just like we would treat any other virus. And if they're old enough, then we can use some of the products that, or some of the medications that will help combat COVID.
Let's talk a little bit about that. So if you have a little one, I think that's the biggest concern is that, you have a newborn, the vaccines are not available for them. What would be the treatment for them?
Remdesivir can go down to 28 days as far as you use it intravenously. So if a child, it's interesting that mothers can pass somewhat of an antibody on if they're positive for COVID. They can pass that on to the baby, and it's very protective of the child. And many times when we test the child, they're negative in the hospital. But if they pick it up, they can actually get the medicine intravenously. Whereas if you're 12 or older, we give it to those children that orally. So there's a gap in that we really want to protect, and 6 months and older can get the vaccine.
I don't know if we have that full screen, if we can put that on the television right now, because I do want to remind folks, obviously you kind of have some age restrictions. The vaccine that we talk about pretty regularly, tell me about the age for that.
Well, just like the flu shot, the vaccine can be given to 6 months of age and older. Now, depending on the brand that you're using, the initial dose is either 2 injections or could be 3, depending on which manufacturer is making the vaccine that you're using. But it is important that we try to protect our children as quickly as we can. Just like we protect them against flu, we should be protecting them against COVID. And as people are talking about the variant and people changing, the manufacturers are changing what variant is changed. And we do the same thing with the flu vaccine. We look at what is important about the flu, and then we use those components in this year's flu vaccine.
And that is a topic for possibly next month, because the flu season is just around the corner as well. So between flu and COVID, we've got to make sure that not only do we protect our seniors, our adults, but also those little bitties.
Very true, and do everything. Keep obviously the covering the coughs, covering the sneezes, washing our hands, all those things you can do, but really try to focus on protecting your children.
Dr. Cyrus, we appreciate your time. We'll see you again next month.
Looking forward to it. Thanks again, Leanne.